Dr. John Anthony Price is a leading consultant general surgeon specializing in hernia surgery. With years of experience and a compassionate approach, Dr. Price ensures your journey from diagnosis to recovery is seamless and stress-free. Here's all you need to know about hernia surgery. Pre-surgery preparation, medical evaluation. Prior to surgery, Dr. Price will conduct a thorough medical evaluation to assess your overall health and any specific risks associated with the surgery. This may involve physical examinations, blood tests, and imaging studies. Pre-operative instructions. You will receive specific instructions regarding fasting, avoiding food and liquids, before surgery to minimize the risk of complications during the procedure. If you are to receive general anesthesia, do not eat or drink anything starting 8 hours before the scheduled surgery time. For example, if your surgery is scheduled for 2 p.m., do not eat or drink anything after 6 a.m. Medication management. Inform Dr. Price about all the medications you are currently taking, including prescription drugs, over-the-counter medications, and supplements. He will advise you on the medications you should continue or temporarily stop before surgery. Lifestyle adjustments. Depending on your specific circumstances, Dr. Price may recommend lifestyle adjustments such as quitting smoking or losing weight to optimize your surgical outcomes. Day of surgery. Anesthesia. Surgery may be performed using local, regional, or general anesthesia. Dr. Price would have discussed with you which you would be receiving before surgery. If you are to receive regional or general anesthesia, you will meet with an anesthesiologist who will explain the anesthesia to you. Surgical procedure. During hernia surgery, Dr. Price will repair the weakened abdominal wall through either an open or laparoscopic approach. The exact technique will depend on the type and location of your hernia. Dr. Price will discuss the procedure with you in detail before the surgery. A mesh is a special type of material commonly used to fix the defect. Recovery room. After the surgery, you will be taken to a recovery room where your healthcare professionals will closely monitor your vital signs as you wake up from the anesthesia. Post-surgery. Hospital stay. In many cases, hernia surgery is performed on an outpatient basis, allowing you to return home the same day. However, depending on the complexity of your surgery, your individual circumstances, you may need to stay in the hospital overnight. Pain management. You may experience some pain or discomfort after the surgery. Dr. Price will provide you with appropriate pain management strategies such as medication and ice packs to help you manage any discomfort. Physical activity. It is essential to gradually resume physical activity after surgery as advised by Dr. Price. Engaging in light activities such as short walks can aid in the healing process. However, you should avoid strenuous activities and heavy lifting for a specific period recommended by Dr. Price. Wound care. Dr. Price will provide instructions on how to care for your surgical incision. This typically involves keeping the area clean and dry following any specific dressing change instructions. Follow-up appointments. It is important to attend all scheduled follow-up appointments with Dr. Price. He will assess your recovery progress, remove any sutures or staples if necessary, and address any concerns or questions you may have. Complications. Infection. Infections can occur at the surgical site or in the deeper layers of tissue. Signs of infection may include increased pain, redness, swelling, warmth, or drainage from the incision site. Hematoma or seroma. Blood or fluid collections can form near the surgical site. These may require drainage if they become large or cause discomfort. Recurrence. Although hernia surgery aims to repair the weakened abdominal wall, there's a risk of hernia recurrence over time. This may require additional surgical intervention. Trust your hernia repair to Dr. John Anthony Price, your expert Consultant General Surgeon. For appointments or emergency, WhatsApp at 876-314-5961 or 876-221-0400.